Hi, my name is Trish Creech. I work for the International USW Health and Safety Department.
And I'm Nick Young. I also work for the Health and Safety Department for United Steelworkers. Today, we're going to be talking about infection control planning around COVID-19.
Yeah, so we need to work together. Unions and employers can prevent and slow the spread of the COVID-19. For those who are at work or about to return to work, the local union should attempt to negotiate a reasonable safety policy. Unfortunately, OSHA has no standard that applies except for the correct use of respirators, and the agency has refused to use its general duty clause for coronavirus. These safeguards will have to be negotiated. Plans should be designed to respond in a flexible way to varying levels of disease transmission in the community. Be prepared to refine the response plans as needed. Coordinate with state and local health officials so timely and accurate information can guide appropriate responses. So each facility is going to vary depending on their state guidelines, issued guidelines.
Some of our members may be afraid to remain or asked to stay home. Many of our contracts do include a right to refuse unsafe work, and OSHA and MSHA also give workers that right, but enforcing that right now is very uncertain. Our members in making that decision is going to have to be upon themselves. People not at work because they are at higher risk, have developed symptoms, or were in close contact with a confirmed case should be considered eligible for sickness and accident benefits, and sick days if applicable, FMLA and other appropriate negotiated leaves. They should be exempt from the absentee policies. The employer should not require workers who are at home, isolating, or at home sick for any other reason to get a doctor's note. To determine how to best decrease the spread of COVID-19 and to lower the impact in the workplace, high-risk people should not be at work. They are much more likely to contract a severe case.
This includes persons over 65, those who have certain medical conditions, including heart disease, lung disease, diabetes, those who are being treated for cancer with chemotherapy or radiation, and those who have a compromised immune systems. Workers who live with someone in those categories should also stay home.
Gloves can be helpful in some situations, but they must be taken off and disposed of carefully to avoid contaminating your hands. Respirators, like the N95, can protect the user if that user has been trained, fit tested, and does not have facial hair that interferes with the seal.
But such respirators are in short supply, and the healthcare workers desperately need them. Surgical masks and homemade cloth masks are meant to protect other people if an infected user coughs or sneezes. There are things you can do to maintain healthy work environments. Health and safety committees can determine who will be responsible for COVID-19 issues and their impact on the workplace. Negotiate flexible sick leave and supportive policies and practices. Assess your essential functions and the reliance that others and the community have on your services and products. Determine a plan for spike in absenteeism due to the increase in sick employees, those who stay home to care for sick family members, and those who must stay home to watch their children if dismissed from childcare programs and K through 12 schools. Establish policies and practices for social distancing.
The union and the company should look carefully at the work process to make sure people can really maintain social distancing, avoiding large gatherings and close contact with others.
Some more guidelines to follow while maintaining a healthy work environment is to perform routine environmental cleaning and disinfection. Perform enhanced cleaning and disinfection after persons suspected or confirmed to have COVID-19 have been in the facility. Implement engineering controls using the building ventilation system. Support respiratory etiquette and hand hygiene for employees, customers, and worksite visitors. Educate employees on additional preparations to take before traveling.
Workers should be encouraged to frequently leave their workstations to wash their hands. If necessary, portable washing stations should be provided. If the facility can obtain a supply of hand sanitizers, it should be placed at all workstations.
Workers who deal with the general public are at a greater risk, and this presentation cannot cover every such situation, but the general principles of personal hygiene, social distancing, and sanitization still apply.
For example, some grocery stores have installed plexiglass screens to protect the cashiers and baggers. Don't fall for quack or untested remedies. Currently, there is no vaccine and no drug that will prevent or cure COVID-19. although scientists are working around the clock to develop them.
None of the drugs or supplements being promoted on the internet have sufficiently tested against coronavirus. Many are dangerous, and people have died from taking them. This includes hydroxychloroquine. Most of all, err on the side of caution. You can't live your life in fear, but you can take responsible precautions to protect those around you, and so can your employer.
This hazard should be dealt with like any other hazard that we see in the workplace. It should be handled jointly, using the hierarchy controls and a systems of safety approach. If you were to have any other questions, feel free to email us at safety@usw.org.
And if you need additional information, that can be found at usw.org/COVID-19. There's also a form there to report COVID-19 incidences. So everyone stay safe, and thanks for watching.